Dr. Peters, there's a phone call for you. Thank you, nurse.
Hi, Doc. It's psychologist Stevens again.
Oh, hi. What do you have for me this time?
I have a patient I hope you can cure. It's a young male and he's suffering from serious hair loss. The hair loss has caused him several problems. He used to be an outgoing and very successful businessman, and now he's barely leaving the house.
Why?
The hair loss has had a dramatic effect on his self-esteem. He is constantly stressed and depressed.
Oh, well, that's not good.
No, I know, and I'm not sure how much I will be able to help him anymore. It's too much for him to handle.
Oh, did you try therapy? You're normally so successful with that.
I did, but I think the only thing that could help him would be to give him his hair back.
Well, in that case, you better send him to me.
So you can help him?
Yes, of course. Stem cells can cure basically anything these days.
Ah, that's great, Doc. I'll send him right over to you.
Tick, tack, tick, tack. Dr. Peters, your next patient is waiting. He wants to see you concerning his hair loss. You talked to a psychologist earlier today. Okay, please send him in.
Hello, doctor. My name is Tom Baldwin. I was hoping you could help me. I'm losing my hair.
Well, tell me your symptoms and medical history. Have you noticed any scars on your scalp? Is your hair shedding or just thinning?
I've not noticed any scars or other skin problems, only that my hair got thin and bald spots started to show up. I have not noticed more shedding than normal.
Well, let's see. The medical term for hair loss is alopecia. It's either age-related or caused by a disease. First, we have to determine if the hair loss is focal or diffuse. In focal alopecia, the hair loss is concentrated to one or several spots. Diffuse alopecia gives a more widespread hair loss and often turns the remaining hair gray. Focal hair loss is generally caused by an underlying disease and can be either scarring or non-scarring. Non-scarring is usually caused by fungal infections. If it leaves scars, it can be caused by many different skin conditions. Diffuse hair loss is caused by hair shedding or hair thinning. Hair shedding is massive hair loss caused by stressful events. The most usual cause of diffuse hair loss is hair thinning, also called androgenic alopecia, which is male or female pattern hair loss. Let's take a look at your scalp. There are no signs of skin disorders and your hair loss is diffuse and widespread. It looks like you have androgenic alopecia. Just to be sure that you're not shedding, I would like to do a hair pull test. You're not shedding just like you said.
What causes my hair loss?
Androgenic alopecia is caused by disturbances in the hair growth cycle. Hair is rooted in a skin organ, the hair follicle, which originates deep in the skin. The hair follicle contains stem cells that give the hair massive regenerative capacity. The hair growth cycle consists of 3 phases. The first phase is the anagen phase, when the hair is actively growing. The next phase is the catagen phase, where the hair root is moving towards the surface. The last phase is the telogen phase, where the hair falls out and the circle starts all over again. In androgenic alopecia, the growth phase is reduced, which results in shorter hair and hair falling off more rapidly. Several hormones, in particular dihydrotestosterone, are believed to cause the cycle disturbances. Dihydrotestosterone is an active metabolite of the male sex hormone testosterone, which stimulates and controls the development of male features. High levels of dihydrotestosterone are shown to inhibit hair regrowth. Inherited genetic factors might increase the sensitivity to the hormone, making you more receptive to hair loss. It seems that defects in several genes can influence the hair cycle.
Okay, I know it's normal for men to lose hair, but also in the 20s?
It is normal among men, even at your age. The condition affects up to 30% of the men under the age of 50 and more than 50% of men over 50.
Can it be treated?
Yes, earlier this was treated with a drug that inhibited the enzyme that converts testosterone into dihydrotestosterone. Unfortunately, it was unsuccessful in advanced alopecia. These days, I take a scalp sample from you and extract the stem cells in the hair follicles that are in the growth phase. These cells will be cultivated and expanded in the lab. The cells will be introduced in a bioreactor together with a scaffold that provides the appropriate biomaterial and three-dimensional structures that allow them to grow into hair follicles. These hair follicles will be transplanted into your scalp and hair will start to grow back. The stem cells of the hair follicle contain information on how to grow into a fully developed hair follicle and to correctly perform the hair cycle. The technique of growing hair follicles in a lab was actually discovered in 2010 by researchers at the University of Berlin.
That sounds great, doctor. Are there any complications?
You will see some white round scars after the implantation, but they will not be visible when the hair grows back. Right after the transplantation, your scalp can be itchy and some minor bleeding may occur. There is a moderate risk of immune rejection, but since we're using stem cells from your body, the risk is minor. The nurse will set up an appointment where we will take the scalp sample and start growing hair in the lab.
Thank you, doctor. I look forward to see the results. What?
Hello, dog. I'm home. And I didn't forget your bone.
Hi, doc. How was your day?
Fine. I helped a lot of patients today.
What did you do? Did you use the stem cells you were talking about before you left?
Yes, I did. I treated one with leukemia, one with diabetes, and a person going bald who wanted to get his hair back.
Whoa, that was a lot. Where did you get the stem cells from?
I got them in a stem cell bank. It's just like the bank that keeps money, except this bank, your account holds your own stem cells.
Okay, that sounds smart. But can you call getting hair to grow back curing a disease?
I'm not sure, but that's what he wanted. And I was able to help him, so why shouldn't I? It improves his well-being, confidence, and life quality because it makes him feel better. How could I possibly say no?
Good point. If I think it's more important to like who you are no matter what you look like. Just take a look at our dogs. We come in all different sizes and shapes and we're all happy. Can you cure everything with stem cells? Like any kind of disease?
Not at the moment, but I bet they can cure some of the major diseases in a few years. There's still an enormous job to do before we get that far.
So, since you can cure everything and everyone, you're sort of playing God at work every day?
No, at the moment we cannot cure everything. But I guess doctors in the future will have a big responsibility on their shoulders when they have to choose who to cure.
So in the future, those who have enough money to pay for a treatment can live forever?
Maybe that's how it's going to be someday. If scientists figure out Wise health get old, we are one step closer to controlling the aging process.
But then, if no one gets old and every sick person is cured, isn't the world going to get crowded?
Oh, I never thought of it that way before, but I guess you're right. Or at least the part of the world that can afford that kind of treatment. And we wouldn't want that to happen, would we?
Some months later,
Oh God, who's calling at this hour? Hello?
Hello, Doc. It's Mr. Baldwin. I just want to thank you for helping me out. I have got my hair back and I couldn't be happier.
Oh, that's nice. I'm so happy I could help you.
I feel like the old me again. Thank you.
Can you imagine when this race is won? Turn our golden faces into the sun. Praising our leaders, we're getting in tune. The music's played by the